supposed to see if I have hypertension.
However, it can be an extremely valuable savings account.
High blood pressure can of course lead to heart problems such as heart diseases, stroke, kidney failure, vision loss, and even more.
Join your health matron, Olubukola, on My Health and I every Wednesday by 12:05 to 12:35 p.m. You deserve to be healthy.
Do a BP check and find out what's going on in your body.
My Health and I.
It's a wonderful afternoon. Today, Wednesday, January 18th, 2023. It's good to have you again on the program, My Health and I'm still your health matron on air, Oluwabukola Aderibigbe. And today on My Health and we are actually starting off on a very good note for the new year. We are doing something very that we are going to be. It's kind of it's something we can relate with. Talking about the Harmattan season that we are right now. And so we want to actually do a bit of what the weather is talking about today. And today we'll be talking about sore throat. But before we go ahead, we'll be going on a very, very short break, and I'll be back and tell you more about the topic and more about what the program is going to look like in the year 2023. Don't go anywhere.
Crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that.
Okay, welcome back. That was Happy by Pharrell Williams. And you're still on to Fortress Radio, giving you strength all day. Fortress Radio is still within the confines of St. Anne's Anglican Church, Molete, Ibadan. And we're, of course, here to give you all the news, the music, the entertainment, in gospel, sports, and of course, good information on business. And right about now, we are talking about sore throat, or what will medically called pharyngitis. So what exactly is sore throat? In fact, what brought about this topic this morning was that as at yesterday, somewhere in my area where I stay, there was this burning bushes around, and I found out that it was difficult for me to begin to breathe, and I had this dryness all over my throat, and I felt, okay, this shouldn't be done. It's really wrong to burn around like that, especially in an area where people live, where there are a lot of people who live very much around. And so we are going to be talking about this sore throat and remedies. What are those things you can do to ease off sore throat and you don't get yourself into trouble? Because as simple as it sounds, it can become something much more than you can handle, and it will end up landing you in the hospital. And one of the reasons why we put this program down, like I'm used to telling us, is that we just want to do some put in place some preventive measures such that you don't have to, go back and go spending much more than you would have ever thought of spending. And so we are going to be talking about sore throat today. And what exactly is sore throat? Sore throat is just, as the name implies, is a painful, dry, scratchy feeling in the throat. And I'm sure most people, most times, almost all the time, have this scratchy feeling in the throat. And it's, of course, one of the very most common symptoms when you begin to, when your throat begins to itch. Now, sore throats, like I said, can be divided, of course, into some other parts. It can be the pharyngitis that we talked about. It can degenerate and become a tonsillitis, and it can degenerate and become a laryngitis. But today we're actually going to come down to the layman's language, and that is just about talking about sore throat. Now quickly, let's just talk about what the symptoms look like. We have talked about one of the symptoms, which is you feel you feel some itchiness on the throat. Of course, it becomes something scratchy. Sometimes when it scratches you over time, it ends up becoming a cough, or then there is this burning sensation. At that point in time, there are people, sometimes when you begin to feel that burning sensation, when you cough and you bring out sputum in the mouth, the sputum is actually has patches of blood at times. And sometimes most people will say, oh, I hope this is not TB. It is not TB. It's just because there is burning in the throat area. Of course, the throat is dry and very tender, and you feel irritated, and it comes most of the time with nasal congestion and what you will easily call, maybe you have a catarrh, and most of the time, because of the way the season is, you probably have blocked nose and some other things like that. And it comes, of course, alongside sneezing. Sometimes you sneeze not because of anything, you sneeze because of the dust, you sneeze because of the maybe combustion around, some pollution in the air. The sneezing comes, it comes along cough, it comes along chills. Now look at this. Some people will say, oh, I think it's going to be a malaria. It's not about the malaria per se, but sometimes these things put together, build up some other things in the body because of the sepsis, because of the infections that you must have taken in via, breathing in. It definitely can come up with some other form of infection, sepsis. And so it can come with chills, it can come with fever, it can come with swollen glands of the neck, such that when you open your mouth, if you try as much as possible to look into the mirror, okay, open your mouth, and you'll find out that there are some glands on the throat area that are so swollen. It's swollen, and at that point in time, you know that sore throat has actually set in. It can also come with a hoarse voice. For those of us who sing, who are into the maybe you sing, you are into the music ministry, you sing and things like that, you are likely to have a hoarse voice. And along the line, as with the chills, with the fever, it can even become so worse and becomes some body aches, and you have, of course, trouble swallowing. When you find out that it's difficult for you swallowing, even your saliva becomes very difficult swallowing your saliva. And of course, it can definitely come up with some kind of appetite, loss of appetite. Okay, so it may even hurt more when you talk, when you swallow your, like I said, when you swallow your saliva, or when you're talking, it begins to hurt you even much more. Sometimes there are some white patches. If you want to get to know better, there are some white patches on the area of your throat, or pus will form on the tonsils. There are pus around the tonsils. At that point in time, the pain is very, 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 very excruciating, and I'm sure you wouldn't want it to degenerate to that level. So quickly, we'll be talking about what the causes are. I've mentioned a few of the causes while I was talking, but we'll talk in total about what it is, what really causes pharyngitis or sore throat. And before then, I will be having a little, very, very short break, maybe less than 2 minutes break. We'll be listening to a short drama piece by the UNICEF, and when we are done, we'll be back on talking about the causes of pharyngitis. Don't go away.
Madam, don't waste my time. You better bring your baby here, or I will just go to another baby. I don't have a whole day.
Nurse, please, what is this vaccine for?
Ask me one more time. So you don't know what your baby is here for?
But I just want to know now. Is it too bad to ask questions? You don't even have to shout at me.
Please place your baby well here before I change my mind.
Now, wow, madam, please help me now. What is this particular vaccine for?
Madam, it is for prevention of killer diseases such as pneumonia, cold, catarrh and cough.
Thanks, Jare, my sister. Auntie Nurse, I'm ready now.
Not now. I'm busy. You have to wait for another turn.
Anyway, whatever happens, I will not leave here until my baby is immunized.
That is the spirit. We are all doing this for our children's health.
That is it, oh.
Okay, welcome back. It's still Fortress Radio, giving you strength all day. And if you are just joining in on the program, it's My Health and I still remain here, your health matron on air. If you're just joining in, we are treating a topic, sore throat, or better still call it pharyngitis. And we had actually talked about some symptoms of sore throat, and this time we're going to be talking about the causes of sore throat. What could actually be the reason for sore throat? Now, causes of sore throat ranges from infections to some injuries and some other things like that, but we'll talk about some peculiar ones that we all can relate with, and that's kind of common with every one of us, especially in this particular time of the year, the weather, the harmattan as it is. So colds, flu, and some other viral infections can be a cause of pharyngitis and sore throat. If you have colds, if you have flus, if you have some viral infections, it can be the reason for sore throat. If you have a strep throat, another bacterial infection, an infection of the throat that is actually caused by a group of streptococcus bacteria, can cause pharyngitis or sore throat. If you have allergies, now for people who have allergies, I'll just advise at this point in time that you need to be very, very careful, especially in the season that we are right now. You have to be careful because there's pollution in the air everywhere. People seize this opportunity to burn the bushes around because they feel because of the dryness the bushes will burn very well and burn fast, and so you need to be very, very careful. So when your immune system reacts to allergy, it triggers like we reacts to allergy, some like pollen, grass. It releases chemicals that can cause symptoms like nasal congestion, watery eyes, sneezing, and throat infection. Like I told you earlier on, around my area there was someone, there was this burning, the bush was burning around and everything like that, and I woke up with this very, very dry throat and some kind of a bit of a runny nose this morning because I kind of slept over in the pollution was just too much in the air. So for those of you who you have allergies, you need to be extra careful of things like this, especially for also for patients who are asthmatic. At a point in time we had discussed asthma on this program, but we will try as much as possible to reiterate the issue of asthma again. So if you are such that have allergies, then you need to be extra careful. So allergies could also be reasons for sore throat or pharyngitis. When the air is dry, of course, right now the air is dry, everywhere is dry, the air is dry, and so you need to make sure that your throat, you take in enough, you rehydrate yourself enough. There's enough moist, the throat is not dry. Dry air can suck moisture from the mouth and throat and leave them feeling dry and scratchy. So what can you do? Most of the time, just make sure you drink a lot of water. Intermittently, especially for those of you who work in production companies who have to do some production and everything like that, or some recycling, and at the end of the day you work with chemicals, it adds more to the dryness in the throat, so one needs to be extra careful there. Sometimes if you are the type that's smokes, you also need to be very, very careful, because smokes, chemicals, and other irritants naturally can, of course, be the cause of pharyngitis or sore throats. So you need to be extra careful. Now, in the next few minutes, we are going to be discussing the home remedy. Like I said, now this program is here so that when you I don't know if you're out there, you're already feeling all of these symptoms that I've just lined up. You have started feeling that way, and you've started having one or two of the symptoms I just mentioned. Just putting this little remedy, it will help you so that it doesn't degenerate and become something worse you won't be able to handle at the end of the day. So one of the very common home remedies you can use is gargle with a mixture of warm water and at least half to 1 teaspoonful of salt. Half to 1 teaspoon of salt. Okay, so you gargle with a mixture of warm water. Now I said warm water, not hot water. Warm, just warm, mild enough that you are able to, such that you are able to swallow, at a time, not so that you will not have to burn your throat. So you can gargle with that. And when I say gargle with that, what it means is that you have to do that intermittently. Maybe do gargle in the morning, and maybe before you sleep at night, try to do another gargle, and do that in another few days, and you'll be well taken care of. You can also drink warm liquids. Even at this point in time, the weather is very cold. It's not advisable that you drink cold things, even though sometimes the weather is a tricky one. I understand some of us, when you're coming from the sun, you feel like drinking something very, very cold, but this is very funny. It's better for you to drink something even warm even when you're coming from the hot weather and you're coming in. But the Nigerian mentality believes that because I feel hot, and the next thing you need to do is just drink cold water. No, just drink normal, just drink water. It doesn't have to be cold. So just room temperature water, just drink, and it doesn't have to be extremely cold. So especially in the morning, drink warm liquids, drink hot tea, and if you have the opportunity or room, just drink hot tea with honey and warm water with lemon. I prefer it with lemon, though. It does work faster for me. You can also, if you are the type that use herbal teas, it can also be very, very good for you. You can drink herbal teas in the morning and suck. Of course, you can also suck on a piece of lozenge or hard candy. There are a lot of lozenges outside there. You can get some lozenges and just suck up on one, lick one, and you'll be good to go. You can also cool your throat by eating a cold treat and treat yourself with some ice cream. Now, most people don't actually believe this works, but it does a lot of wonders, especially when your tonsils are swollen. It will help kind of cool. It will just ease off your throats. So you could do with some cold ice or some ice cream, good ice cream. And of course, rest your voice. For those of us who do the talking job like I do right now, you can also, find time to rest your voice. Make sure you rest very, 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 very well. So, I'm also quickly before I go, we'll still be doing some bit of health fun facts, some major things. It could be funny, but there's some major things about your health that you need to know. Now we'll also be talking about when you really need to see a doctor. But before we go ahead, we'll be going on another very short break. Don't go anywhere. I'll be right back.
ǹjẹ́ o ti gbọ́ pé Fortress Radio ti balẹ̀ ká sórí Google Play Store? Pẹ̀lú Fortress Radio lórí Google Play Store o láǹfààní láti máa gbọ́ wa kétékété káàkiri gbogbo àgbálá ayé. Ìrọ̀rùn ló bá dé. O lè download app wa lórí Google Play Store. Ìwọ ṣáàtì tẹ Fortress Radio sórí Google Play Store. Tó o bá ti download rẹ̀ tán, ìwọ ti bọ́ sáyé nù.
I see I know we do this cause we care. We care for the people. Be care for the environment. Be care for the world. Nani. Oh, Anila Nani. Spread love to your friends and family. Sterling environment to make over. All over the world, be a great example. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ìmọ́tótó ilé, ìmọ́tótó ara. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Wọ́n ní kó gbálẹ̀, dúlẹ̀, fọ́lẹ̀, répété, gbálẹ̀, dúlẹ̀, fọ́lẹ̀, répété, gbálẹ̀, dúlẹ̀, fọ́lẹ̀, àníkó répété, gbálẹ̀, dúlẹ̀.
Welcome back. That was Olamide talking about the environment, keeping your environment very, very, very clean. So welcome back again. It's Fortress Radio, and we are here to give you strength all day. Now we're actually talking about sore throat, and we have talked about the symptoms of sore throat. We have talked about the causes of sore throat. Now, we have also talked about what you need to do, home remedies, the things you need to do to just keep yourself away from getting sore throat. And now there are times, like I said, there are times that these things sometimes will get out of hand, even though we don't want them to get out of hand. And so when do you really need to see a doctor? When you have when the sore throat is severe. Somebody wants to ask me, how do I know it has become severe? You don't even need to be told when it's severe, because one thing I know about sore throat, because I've been there before, one thing I know about pharyngitis is that the pain is so excruciating that you hardly will be able to talk, and nobody will tell you that this is what severe is. This is what severe means. Nobody will tell you what that is. So when you need to see a doctor, when it becomes a severe one, of course, when you have trouble swallowing, and you know that just to swallow ordinary saliva is becoming like an issue for you, then at that point in time, you go see a doctor. Don't wait. And I usually will tell you this: when you begin to have those white patches, they're called exudates. When you have those white patches, if you have the opportunity to pick a mirror and look at it, and you find that your tonsils are all swollen and there are patches all around and everything like that, okay, so you need to go see a doctor quickly, because at that point in time, the doctor will be able to prescribe for you some antibiotics to use that will help you get you off the pain of sore throat or pharyngitis. So you could also, when you're beginning to have trouble breathing, or you have pain when you breathe, and that's also a very terrible one. When you're breathing and it becomes something very difficult for you, it's good that you see a doctor. And when it eventually comes up with a very high fever, of course, the infection is it's so high, and so that's the reason at which the reason for which the fever is very high. So if at 38 degrees Celsius your temperature is that high, then it's good for you to go see a doctor. And if, of course, it's painful all the time, sometimes sore throat can even come with a stiff neck, and we don't even want it to get to that point when you have a stiff neck. So but when you're beginning to experience that, it's good that you see a doctor. So like I had iterated earlier on, when you are beginning to find that there is blood in your saliva, when you cough or you bring out sputum and all that comes from your mouth is it's covered with saliva, it's covered with blood, it's good that you go see a doctor. And when your sore throat begins to last more than a week, you have tried by all your best to do the home remedies that I gave to you, and you have done all of those things, and still the symptoms of sore throat still persist for at least a week or more than a week, it's advisable that you will go see a doctor. So at this point in time, you need to be very, very watchful and careful, especially at this point, at this season that we are in, this Harmattan season that we are in. Though it's a very beautiful weather, most people love it. I love it because that's the moment there's freshness everywhere, except for the pollution in the air that sometimes you get. And so when it comes to that point that it has brought about sore throat, then you need to watch it and take good care of yourself. Now, lastly, on the last segment of the program, we want to talk about few things, some health fun facts, some things you need to know. You might not, you might think these things are not true or not real, but they are actually good for you to know about these things and probably work and see if you can, use one or two of them. It will help you a lot. Here it's one here says chocolate is good for your skin. Its antioxidants improve your blood flow. Chocolates. Someone will say chocolates. There are some chocolates that don't have need high content sugar in them, and so you could look for such chocolates, and it's very, very good for your skin because of the high antioxidants that will improve the flow of blood in you. Okay, so your kidneys filters your blood up to 300 times in a day and need water to function optimally. And what's that telling you? What that is saying is that you need to drink water very, very well. Drink water all the time. Most people will tend to feel like I feel thirsty, and the next thing is to go take a soft drink or get some, what do you call these drinks, these energy boosters and things like that when they are tired. Once they are tired, the next thing is drinks and drinks and drinks. No, it's not good enough for you. The best thing to do is drink water, because your kidneys does that job of filtering your blood up to 300 times in a day, and so you need to drink a lot of water to help your kidneys. You need to drink a lot of water so that the kidneys will not break down. Some of us even eat till late in the night, and some of us drink till late in the night, and you know what that means. You are giving the kidneys more workload, and as it keeps working, a time will come, we'll pray your kidneys should not just go break down. So you need to drink a lot of water. If you have to take any drink, let it be water. And the last one I'm going to give to you today before I round off on the program: breathing deeply in moments of stress anytime during the day brings many benefits, such as a better circulation, decreased anxiety, and reduced blood pressure. Breathing deeply. So if you're there at home, I have done mine right now. You can, if you are listening, I did that just a second ago. Breathe very, very deeply. It helps a lot. It is not only when you are depressed, or you are thinking, or you are into some kind of emotional stress that people when the breathing is when it comes willingly, when you breathe deeply willingly, in the moments of, especially when you are stressed up, it's good for you. It's very, very good anytime during the day, just anytime during the day. And one of the major benefits is that it allows for better circulation of blood, and of course it decreases anxiety and will reduce blood pressure. I'm sure nobody wants high BP. So thank you very much for watching, for listening, and of course for watching us on Fortress Radio. And we are here, of course, to give you strength all day. If you still want to hook up with us on all other social media handles, on Facebook, Instagram, and on YouTube, it is Fortress Radio. And better still for you, just go ahead, download the Fortress Radio app on Play Store. It's Fortress Radio Ibadan. Fortress Radio Ibadan. Thank you very, very much for watching. We'll be here again next week with another very interesting topic to discuss. One that you can, of course, relate with. No matter what the matter is, what matters most is that your health matters. Thank you. See you next week. Bye.
Fortress Radio. Your online radio. Music. Check. Music.